Welcome to our panel breakout session, where we're going to be discussing on the topic staying below the radar, innovation, partnerships, and technology for health impact in Nigeria. My name is Ota Ahigbe. I am the Director of Partnerships and Programs at eHealth Africa. eHealth Africa is a health technology nonprofit organization that develops digital solutions and platforms to improve health outcomes across Africa. In a few minutes, we'll start our conversation. However, before we kick off the conversation, I'd like to invite our Executive Director just to formally open the session with a brief opening remarks. Welcome, Atif.
Hi, everyone. My name is Atif Fawaz. I'm the Executive Director in eHealth Africa. We're very honored to have all of you here, and the team will take you through some of the work we've done in Nigeria. It will be interesting to learn about how we also managed to do technology work in a very complex environment as Nigeria. Our country is quite diverse, quite complex, and quite interesting, and we manage as eHealth Africa to always find the right balance between technology and culture. Maintaining all the cultural aspects of the country and making sure that technology adds a lot of value to what we do, but without touching the cultural restrictions in some of the areas. So we welcome you all to have this conversation, ask the questions you would love to ask, and we hope it's interesting as well. So thank you, and you're welcome.
Thank you, Atif. So in a few minutes, and for the next 50 minutes, we're going to dive into the exciting topic of healthcare innovation in Nigeria. And here, with the panelists I have here, we're going to be talking about the fact that although technology is undoubtedly a powerful tool, it is not the only factor that drives success. So in this conversation we're having over the next 50 minutes, we're going to explore how a combination of technology, strong partnerships, and a deep understanding of local context can lead to significant health impact. And so I have an esteemed set of panelists here, and I'll just begin to introduce them. But before that, I just want to say that we're going to try to make this a very interactive panel discussion. We're not going to wait till the end of the session to open up to the audience. So somewhere as we're discussing, we'll take a pause and then take comments, take questions. The point of that is to make sure that the conversations are very rich and that we incorporate your thoughts and your feedback into the discussion. The idea is at the end of the day, we have outcomes that are actionable and that we can be proud of the discussion that we've had. So without much ado, I'd like to invite our first panelist, Michelle Intir. She is the Post-Investment Director at Delta 40 Venture Studio and a member of the Board of Directors at eHealth Africa. I'd also like to invite Sarah Malaba. She is the Chief Impact Officer at TICO, a seasoned public health care leader with over 17 years of experience. Welcome. I'd also like to invite Olamide Okulaja. He is a Senior Director of Skill Programs at Maisha Meds, an expert in healthcare financing and business development. Welcome. Up next, Dino Rek. He is the CEO of Audere, a renowned global health leader with a passion for leveraging technology to address healthcare challenges. Welcome. I'd like to invite Rachel Aldian. She is the Director of Global Programs and Products at Jacaranda Health. And last but not the least, I'd like to invite Abdulhamid Yahaya. He is our Deputy Director of Global Health Informatics at eHealth Africa. Welcome. Welcome, ladies and gentlemen. Thank you so much once again. So very quickly, to start our discussion, I'd like to invite each one of you to just share a brief introduction I was very careful not to, read out your profiles and, read out the introduction because I wanted you to introduce yourself with your own words. So just give a brief introduction about your organization, the work that you do, and your unique perspective on the theme of our discussion today. And while you're also sharing that, I'd like you to, share your reflection on beyond technology. What do you think are the key drivers of successful market entry and public health impact in Nigeria, in sub-Saharan Africa, and indeed in Africa? So I'd start with.
Thank you so much. Good afternoon, everyone. Thanks for filling the room. This is really testament to the fact that health is such an important topic. It is such an opportunity. This is also testament to the fact that Nigeria is on everyone's minds. I see some friends from the past when I started out in public health, I like to say 100 years ago. And so as introduction, yes, I'm a public health specialist. I haven't had the opportunity to operate and practice, let's say, in the last decade. But while on the board of eHealth Africa, it's really wonderful to see a set of solutions that I think is beginning to crack at making an impact. And we're here to talk about specifically the tech-infused solutions, if you will. So that's by way of intro. And when I'm not thinking about health or investing in health, which I do about half the time, through eHealth Africa's, I would say, newest baby, EHA Impact Ventures. So when I'm not doing that, I also invest in climate-linked sectors like agribusiness and energy. And so now that I've done the intro, let's see, what's the question? Yes. For me, I would like to highlight two things. So as a pan-East African, the first thing that shocks anyone getting into Lagos or really any city in Nigeria is the scale, like the density and the scale. And today we're looking at 213 million people, over 60% of which are youth. So I think that is the opportunity. We cannot underestimate the needs of young people, but also the skills and the experiences and the energy and the knowledge that they bring. And so I would say for me, that's always top of mind. When it comes to the shock of the scale, after, from 10 plus years ago, after getting into Lagos and Abuja and really understanding these big cities, I then, recently, and I see some of my fellow board members, I then went to Kano, where eHealth Africa houses over 200 employees. And I said to my Lagosian friends, oh, I'm going to Kano, I'll be back in a week. And then, we can hang, as we say in Kenya, we can just do the social scene. And they're like, well, what are you doing in Kano? I'm like, well, I'm on the board of eHealth Africa. And they called me every single day to make sure I was okay in Kano. And this was not during the time of any of those, turbulences that rise. And the reason I state that is because South and North Nigeria, and that's just a very crude cut of the country, are very, very different. And within that, of course, you have very specific variances. And I know the Nigerians here are looking at me and nodding. And so because of that, I would say a second thing I'd like to highlight is let's really understand those regional and local differences. And there are ways that we can do that. And I know that this esteemed panel will highlight them, but those are two things, the youth, but also the specificity in this mammoth opportunity that is Nigeria. Thank you.
Thank you. Thank you for setting us off. Good afternoon, everyone. My name is Sarah Malaba. I work at TICO as the Chief Impact Officer, where I support all of our delivery in our 7 countries. TICO is an African nonprofit organization that exists to support, to address the triple threat to the lives of adolescents and young people in sub-Saharan Africa. Our mission is centered around reducing teen pregnancy, reducing new HIV infections, and addressing sexual and gender-based violence among adolescents and young people in sub-Saharan Africa. So reflecting a little bit around the question of what it takes to do an entry in a country like Nigeria. And Nigeria is our newest country. We have been in there for about a month now with the support and with the partnership of eHealth Africa. So what is important for us when we thought about entry into Nigeria was really looking at grassroots partnerships that are in existence. One, leveraging on the fact that the country is massive and it needs contextualization. It was clear to us as an entrant into that market that we needed to go in with a partner that truly understands the context, and hence our partnership with eHealth Africa. They are more proximate to the country, proximate to the populations in the country, and they have understood the health delivery system. So we are leveraging on those relationships that they have to be able to go in and scale with them. The second important point for us as TICO is that we don't go into a country to duplicate. We go into a country to complement. We don't go into a country to continue to fragment the health system. We go in to defragment the health system. And that's why working with a partner such as eHealth Africa as part of our entry strategy is extremely important. So I'm going to leave it at those 2 points because I would like for the rest of the panelists also to have something to say. Thank you.
Good morning, everyone. My name is Dr. Olamide Okolaja, and first of all, I'm very, very happy to be here and also very humbled to be amongst such innovators to be giving this talk. I've had a very humble and interesting career. I started with the World Bank, where I was a healthcare financing specialist supporting Nigeria in attaining its mandate of universal healthcare coverage. And then I moved over to Farm Access, and I worked as the Director of Advocacy and Communications, working very closely with the engineer that is sitting up front here, who is the country director. Worked there for a couple of years also before I moved to Lagos State, where I became the technical advisor to the Honorable Commissioner for Health. And I was also the health economist at the Lagos State Ministry of Health before eventually I joined MyShemeds, which is a fantastic organization, by the way. And we are also open for partnership, Tico. But I think that the most important thing for me about my journey is that it has given me a very unique opportunity to see the perspective of healthcare service delivery from a prism-like approach, where you see the requirements of each stakeholder in the healthcare system. And for the innovators, and I think that we as innovators, we need to really correct our expectations, because a lot of times we look at our innovations as the end to a means. Meanwhile, it is the means to an end. Technology is an enabler. And you developing that solution, you developing that innovation, you're key to making billions of naira or dollars or whatever it is. It's your opportunity to sit down in the room with other innovators and see how you can collaborate to be able to deliver genuine impact. And I think that is one of the things that we should be able to take away from conferences like this, because it is important that we realize that the financing and fiscal space is constantly reducing. And the need for us to continue to do the things that we're doing to get what we're doing or whatever resources we have is increasing, so that we need to do more. And the only way to keep it down is through synergistic approaches. And I'll give examples during the conferences, the talks as we go along. Thank you very much for being here.
Thank you.
Thanks very much. Hi, everyone. My name is Dino Rek. My background is as a global health implementer, but 3.5 years ago, I found my way to a technology company, a nonprofit based both out of Seattle and Johannesburg called Outerray. we focus on both building, sourcing, evaluating and deploying AI capabilities through other partners and platforms. So an AI service model, if you like. It's a great pleasure for me today to be sitting in a room with so many of our partners, Masha Meds, Elephant, EHA soon, FIO. And the idea and concept is really that not every platform partner needs to spend the money, time, and expertise on building their own AI. They can collaborate with a global health-funded partner, a nonprofit who has deep expertise and quality in AI capabilities. And it's been wonderfully successful with Masha Meds. We've scaled massively in the last year. So I'm very excited to be here and tell you more about that today. In terms of entering new geographies and Nigeria specifically, I think for me, the biggest thing was context, but along with that is networks. And when you work with a partner like EHA, the networks to solve any problem you might encounter in a new place is really important. So our model is, as I said, B2B. We work with well-networked partners with good relationships within the countries we enter. Thank you.
Thank you, Dina.
Great, thank you so much. My name is Rachel Aldian, and I'm the Director of Global Programs and Product at Jacaranda Health. So just to tell you a little bit about Jacaranda Health and what we do, we work to deploy a package of digitally enabled solutions to improve maternal and newborn health outcomes. Our flagship product is called Prompts, which is a two-way SMS service that mothers can enroll in and receive gestation-specific information about their pregnancy, as well as get access to an AI-enabled help desk that allows them to ask questions and get personalized answers. We have deep roots here in Kenya, but have recently partnered with eHealth Africa to expand into Nigeria. And regarding the question about what are those key factors, I think two main things come to mind. The first is those deep partnerships. So not looking to necessarily replicate solutions, but leverage on partnerships and leverage on networks to be able to find the best fit for the solution. The other one is making sure that we not only design solutions for context, but also deeply design for users and acknowledge that users are different in the different markets that we come into. So that deep process of user design, I think, is very important when we scale to any additional markets and look to scale globally throughout Africa.
Thank you.
Yeah, thank you. I get the dubious honor of going last. So what that means is most of the points might have been touched a little bit on. So maybe I will still try to see what I can say. So my name is Abdulhamid Yahaya. Currently, I'm the Deputy Director or Lead for Informatics for eHealth Africa. And for the past 7-8 years, what that means has been trying to develop innovative digital solutions to support our programmatic objectives. And I think our objectives are quite simple. We strengthen health systems, and we also respond to public health emergency. So those are the core of what we've been doing for the past, maybe getting to 15 years or so now. And over the course of trying to support these programmatic objectives, I think we've had a plethora of digital solutions that we've had to develop to support the acceleration of or the achievement of these program objectives. We had some in polio during the COVID-19. We had some for VDD vaccine tracking. We had for supervisory healthcare supervisory performance management. We had to develop digital solutions as well. So all of these are critical to what we do day to day at EHA. So now coming to the theme of the today, the theme of the conference, which is about key drivers for what is it called? Key drivers for health, for key drivers, sorry, for key drivers for innovations, partnerships, apart from technology, right? Key drivers that helps with market entry penetration and also driving public health impact. I think we'll be talking in more details, but what comes to my mind briefly will be strong partnerships. These are key because this has been how we have been able to penetrate several countries in Africa where we work. You need to build sustainable partnerships. And then also contextualization. I think we've mentioned, someone talked about that as well, is key. You can't have this conversation without talking about contextualization. And this is very key because different communities have different cultural, different demographic, different socioeconomic factors that you need to factor in if you want to drive public health impact, or if you want to even break into that particular market very successfully. So, and then you have even localization as well, because you need to make sure you localize the solution if you are going to be successful in any way. So that's another key factor that we need to look at. And then lastly, because of time, I think we often forget the regulatory aspect is very key, because sometimes if you get into a market where you do not meet certain regulatory requirements, that could end up being the end of that particular public health emergency or public health program that you're trying to deliver. So you have to make sure you check what are the local, what are the national, subnational, or regional regulatory requirements that you need to meet, and then you do that, make sure you meet them accordingly. We'll be sharing experiences and examples during the course of the conversation for sure. Thank you.
Thank you very much. Thank you to all our speakers for opening the conversation. I want to start with you, Sarah. TICO over the years has gone into several markets and several countries. And like you said, Nigeria is, in quotes, your new baby. You've been here for about a month, but had conversations for almost a year in shaping your strategy. So, I mean, your experience is still fresh. So I'd like you to share your thoughts and maybe your reflections on what cultural considerations would you say are essential for tailoring healthcare platforms to Nigeria's unique market dynamic. I mean, you could feel free to share from your experience from other African countries, but just to make it contextual to this conversation. Thank you.
Thank you. So when we think about cultural consideration, we need to think about the fact that culture is people's way of life. And when you think about it in terms of the health system, you want to think about culture from the point of the community, culture from the point of individuals, but also culture from the point of the health system setup. You know, how has that been structured before? What languages do these sectors within the health system talk to? Who influences this system? Who is the gatekeeper in this system? All that is part of culture. You also want to ask yourself, what is the pain point that we will be trying to address? What is the pain point from the eye of the individual when it comes to the consumer? What's the pain point from the eye of the community in terms of structure, gatekeepers? What is the pain point from the health system perspective? And when I talk about health system, we think about the community health system and the facility where, you know, there's a lot of preventative and treatment that is taking place. So when thinking about technology, and indeed TICO delivers through a technologically powered ecosystem that links demand generation to supply, so that we can say, does the information, education, and communication that the individual receives on their health support them to make a decision to go into the health facility or to access a health product or service that meets their health needs in order to address the issue? So thinking about the user is important from a cultural perspective, and those aspects of the users that I have mentioned. The other important thing is about community organization and structures. And when we think about communities, it comes from, you know, the basic thing around how far is the facility from them? How near is it from them? Do they like to come into the facility, or do they love for providers to go to them? What kind of information are they looking for? What gaps do they have? What are their pain points today? So I could give an example. When you're talking about a girl in Nigeria or Kenya or Burkina Faso or Ethiopia, which are countries where we work in, you know, a girl will tell us sometimes, I feel intimidated by the health system because I want to get in to get a health service, but I'm not sick. Why do they need to take my body temperature? That's a question for her, because she's wondering to what extent does her body temperature relate to her need for contraceptive, for example. So that is how she sees her pain point. Her pain point is the time she spends in the triage, talking to the nurse about, you know, about her, why she's there today, her temperature, and so on and so forth. So we must also think about structures in terms of policies and procedures. And I think our colleague from EHA has really touched on the regulatory process, because the culture of the health system is really the policy, the legal framework, and the procedures that the healthcare providers have been given. Without understanding that and how to leverage on that from a pain point perspective, from an opportunity perspective, then it will be difficult to engage even from a technological perspective. Thank you.
Thank you so much, Sarah. I really do appreciate the insights that you've shared. I'd like to very briefly just turn the lens to the audience. We have heard the opening remarks from each of the speakers. We have also listened to the cultural considerations as shared by Sarah and drawing from some real life experiences. So I just want to find out if there's any question or comments, just to provide some feedback to enrich the conversation. The question can be directed to any of the speakers. Anyone? Oh, yeah. Yes, please.
Thank you. My name is Mercy Odhiambo, and I have one question. In regards to culture, what can the current governments strengthen within the digital health governance that can cater to the different various needs of the different setups, just to make sure that the cultural context also catered for? Thank you.
Thank you very much, Mercy. I really appreciate that. So any one of our speakers can actually take that question. And if not, then we'll probably have Sarah take it. Oh, Dino?
Yeah, I'm not sure if it's the right lens, but I'll approach it from an AI perspective. And I mentioned networks, we mentioned context. For us as a AI partner, the cultural context and access to local data sets, local partners, local communities, local design functions when building and customizing AI tools are very important. So country governments thinking about how they promote AI innovation with a lens of access to those types of services or those types of local resources means that AI innovators can build culturally context-specific AI that really has great adoption and, importantly, trust. We heard so much about trust this morning in the plenary, and everything we do in life, the relationship has to be based on trust, and those culturally, contextually specific inputs make the AI and the engagement more trustworthy. So thinking about that from a government and ecosystem perspective, a lot of it has to do with data sets, community involvement, and local design.
Let me just add my voice to that, because when you think about culture, and because I suspect that you're Kenyan, so I'm going to use the public participation, frame, because it is about the voice of the communities as well. In that governance, we need to design for the voices of the communities in the different facets of that community and what is required for them. Again, one size doesn't fit all. What works for under fives doesn't work for adolescents, doesn't work for pregnant mothers, and so on and so on, so forth. So communities are not homogeneous. Communities have unique members in there and their voices need to be included. And so we must design for inclusion of those voices and meaningful inclusion at that. Sometimes when we talk about technology, some people say, if we ask the community what they want from a technological point of view, we don't think they know what they want. Is that true? Yeah. I like the nods in the room that might not be true. So we need to think about that and also factor in the question around equity, because this is all about making sure that technology doesn't exclude, but actually ensures that we address equity issues. And I think the governance structures need to be able to structure for that as well. Thanks.
Thank you. And so I'll just take the conversation to Rachel. So I know the Jacaranda prompt was developed in Kenya, but you're now also, implementing it in Nigeria. So I just want to find out, and for you to share with us, how can solutions developed for sub-Saharan healthcare challenges be scaled to drive impact across West Africa and beyond?
Great, thank you so much. I think I'll start by saying I think it's important as innovators to start with realizing that we can't assume that all solutions will directly translate to new markets. So if we have a solution that works in Kenya, it's important to start by realizing that this isn't a solution that we can necessarily copy and paste directly to additional markets. Jacaranda has expanded from Kenya to Eswatini to Ghana, now to Nigeria. And for each of those expansions, we've had to make changes to the solution we developed to be relevant and to make sense in those new contexts. And one of the things that we've really realized is the importance of taking a very humble approach. So realizing that you need to make sure that you leverage different stakeholder feedback, that you leverage user feedback, guidance from ministries of health, to ensure that when you adapt and scale a solution, it makes the most sense for users. So I'll give an example of our partnership with eHealth Africa. When we were actually coming to Nigeria, we sat down, had a workshop where we actually looked at the messages that we had developed for Kenya with an eye at identifying gaps and changes that needed to be made. So not an eye at necessarily agreeing to those messages and copy and pasting them, but really looking for what are the gaps that need to be acknowledged and need to be changed. And one of the things that we identified, and this came from the feedback actually of community health extension workers, was that we weren't addressing myths and misconceptions enough. So we were able to upfront during the design, be able to make those changes and ensure that that's something that you're able to include. The one other thing I'll say, because I know we're running short on time, is the importance of language, especially when we think of generative AI. So we know AI is this new sexy thing that everyone wants to include, but how do we ensure that when we include generative AI, it's actually in the languages that people speak? So we know that most off-the-shelf models are most fluent in non-local languages. So one thing that I would encourage all organizations when scaling, if you are going to use generative AI, think about how you're going to ensure that that is available in the languages that people actually speak. Otherwise, we're creating further inequalities between people who can access that information and who can't.
Thank you. Thank you so much, Rachel. And I'll just move to Micheline. I mean, you have such a strong experience in investment advisory, and also being the member of the board of eHealth Africa. You provide a lot of support as far as strategic advisory around investment, and now with the eHealth Impact Ventures, you do a lot of that. So I just want to find out, what should international investors prioritize when assessing opportunities in Nigeria's health ecosystem?
Thank you. Let me list my tops. Regulation has been mentioned. I put on my investor hat, and I would definitely check, even at startup phase, that a founder is thinking through, have you checked in to see how this chimes in? And often people are afraid of that, but actually having that cover is something that can elevate one's presence. I think that many founders perhaps don't have that sort of government policy orientation, or maybe they're scared of it, as I was musing, but I do think that's important. In no order, look, we've got to talk about like the macroeconomics in many of our countries, and specifically Nigeria. Each time I went, I personally felt the devaluation, as I know Nigerians do from day to day. And I don't think that the prospects are great in the short term. I think experts are saying we're going to see like continuous strain. And so there are liquidity issues. And so investors are going to be sort of holding their purses. I would say let's watch, let's just be more supportive of founders and of startups to make sure that the right funding instruments are used. Somebody who's taking, let's say, debt, in Naira, and having to, for whatever reason, spend in dollars, is basically shooting themselves in the foot. And so I think it's really time to think about how to hedge while, again, looking at the best kind of funding instruments and currencies right now. Funding in local Naira is something that, we're also looking at. where that's appropriate. We've talked here third about, users and adoption. And, I really think within all of this is the influencer in a household, in a community, in a health center. Like, who's telling you about your health? I mean, you're extremely educated and so on, so you probably have the right people. But information is coming from grandma, from TikTok, from God knows, from everywhere. And so, yeah, and so I would really look at any idea to say, what are the assumptions that are being made about how this cool new thing is going to be used? And does it just assume that, oh, it's this fancy AI thing, or it's this fancy, tech thing, without really looking at specifics around what's influencing the person that's supposed to be your consumer in the long run. If I had a fourth, and these are just quickly and in maybe no order, I think a lot about exits and the way, like, if we look at VC or even, impact funding, PE funding, there are different ways to exit. And what I like to do is to try to join up two things. One, as an investor, let's say, for example, at EHA Impact Ventures, we're investing very small ticket sizes, $10,000, $20,000. So who's next? Who's in the $50,000 to $100,000? So joining up that value chain of investors, but also for the founder, for the startup, who, what are you building for? Are you building to, sort of bricks and mortar exist here forever and ever? Or can you join up with somebody else? And somebody mentioned synergy here, somebody to provide some complementarity to your service. That's an exit. And so that might not only be in the health sector, right? If you think of health, you can actually just put everybody in there. Logistics might buy you out, a transport company to transport your services. If you're a clinic, you might join up with a pharmacy. You might also, I don't know, be doing health and want to do nutrition, so join up with a manufacturing company. So I do think a lot about JVs and synergies in terms of growing to scale. Those are some thoughts.
And thank you for mentioning AI, because it's just connected me to the next question, which is Dino. It's a similar question to what I asked Micheline, but the focus for the question I want to ask is what key factors should international investors and donors prioritize when it comes to AI opportunities in sub-Saharan Africa's health tech ecosystem?
I think, one of the big debates we often hear donors speaking about, or investors, is this notion of there's so many existing challenges within the digital health infrastructure, should we solve those first before we invest in AI? And I think the one take-home message is you spoke about synergies. We see these two going together, and AI providing an opportunity to fast-track some of the digital health infrastructure challenges that are there. The potential of it is so great that it gives us extra momentum, and as a global health community, an additional voice to advocate for increased funding. And if you look at global donors, the amount of money going towards digital health infrastructure or AI from philanthropy or big global donors is still relatively small. And I see AI as a huge opportunity to advocate for a bigger total ticket budget for these types of synergistic interventions that go together.
Thank you. Thank you so much. With that, I will turn the lens again. If we have any questions or comments. Yes, that was a fast one. Thank you.
All right, thank you very much. So my question is around how some of these solutions translate into better health outcomes, as well as also the mismatch in healthcare investment as in the outcomes. So as we all know, in the recent National Demographic Health Survey, despite the investment in healthcare in Nigeria over the past 5 years, some of the maternal healthcare indices have not been really good, and there've been a lot of investments in digital health and all of that. So what advice, or would I say, what strategies would you give to innovators, implementers to incorporate during design of these solutions, that it would ensure that these solutions are not just being developed and deployed, but actually translates into better healthcare outcomes? Thank you.
Thank you very much. You didn't say your name though.
My name is Dr. Hafiz Said Yaro, and I work with Pathfinder.
All right, thank you, Dr. Hafiz. So any of our Panelists want to answer that? Sarah.
I'm happy to talk about how the TICO application, the TICO software could translate into impact. So at TICO, we leverage on technology to power ecosystems that deliver for adolescent girls and young women and adolescent boys and men as well in sub-Saharan Africa. So what we do is to be able to power how demand generation is being done, to enrolling these adolescents onto the TICO platform as members of the platform. And because of that, then link them to quality assured youth-friendly services that would have also mapped onto the TICO platform. What we are able to do with our technology is to see the user journey of this adolescent from the point of mobilization in terms of the community, so we can tell to what extent does an enrollment translate into service uptake. So we can talk about a conversion between demand generation and service delivery. And at TICO today, we shoot for about 85% of conversion rate. 85% is good for us, and that's the minimum that we would love to see. So for every 100 young people mobilized, 85 of those should go up and take services. That's when we know that the demand generation was correct. We got the correct young person who needs the type of services that we provide. At the provider level, what the technology helps us to see is how many services that this young person take. And this we try to measure how integrated the services are, because we have built our platform and our delivery to be able to be fully integrated. So when we begin to see that a young person is only getting one service, then we ask ourselves, what is going wrong in that health facility? Is it a commodity issue? Is it a provider issue in terms of training or biases that we are dealing with? And then ultimately, we also support the ones who have a phone to be able to rate the services. What that tells us is to what extent they are satisfied with the service and to what extent the service is not satisfactory and what really could be the issue. So we move then from just collecting data for the sake of it, but having data that is real time and that helps us to understand where in the health system is it breaking for the adolescent and the young person, and then ultimately be able to quantify the kind of outcomes that we're trying to shoot for. For example, to what extent do we prevent a teen pregnancy? To what extent do they discontinue on antiretroviral therapy, and so on and so forth?
Thanks a lot. And I'm going to Dr. Olamide. You've been around. You have a lot of experience. So, I mean, from your perspective, what emerging trends in digital health and public health innovation are likely to shape Nigeria's healthcare landscape in the next 5 years? And feel free, if you feel you want to speak beyond the emerging trends, that's good.
Thank you very much. I think me being around can also signify something else, but I'll stick to the order of the day. So, I mean, talking about the emerging trends, I can say what everybody in the room wants to hear, which is what everybody is trying to do. For example, we've spoken a lot about AI, and we have a lot of funds in the donor space that is looking at how we can integrate AI into healthcare service delivery. I can talk about solutions for supply chain management and how we can facilitate that. And we can also talk about electronic medical records. And I'll give an example of that. So currently, Nigeria has gone on a drive to digitize public facilities. I don't know how many people in the room that knows that. And they're doing that leveraging on a World Bank fund of $500 million, where they are going to digitize all these private facilities and create some level of interoperability to, ensure the transfer of data from one facility to the other. But the question for me, the real question, is that we can talk about all these emerging trends, but how do we key into them? And I think the key word here is collaboration, and we cannot say it more than enough. So I'll give you an example. When the Nigerian government made an RFP for this innovation, they didn't talk about EMRs. They talked about organizations that could come together and deliver a turnkey solution. So if you were just an EMR, there was no way for you to be able to really apply, because they will ask you the next question. Who is going to provide the hardware, and how are we going to link the LAN and the WLAN and the WLAN and all of that? And so immediately you are cut out of that. But if you had collaborated with other people in the healthcare space that had the technicality to do this, you can really focus on what you are really doing and let everybody else take, a piece of the pie. And then you can actually then begin to see adoption of your innovation. And so again, it's important that we look at an alignment of the health priorities and strategies of that country. So a lot of times we sit in our rooms and we decide that this is the innovation we're going to work on. We get some donor funding to scale to a certain level. And unfortunately, there is up to just a particular level we can scale with donor funding. If you want true scale, you have to find a way to partner with governments. But one thing you have done is you've not put into cognizance what the health priorities are in that government. And so you have difficulty, and then you're frustrated and wondering why you're not moving forward. But there are health priorities and strategies that are happening at the level of government. And it's also important that in doing your innovations, you carry them along. Because we also think that we can just get an innovation, scale with donor funding, and then ta-da, here we are, we can solve all your problems. And government is looking at you and wondering what you're talking about. But if you had taken them along in the journey, then they begin to see the value even before you do your RFPs and all of that. And they then just adopt your system because it makes sense and because they also have a role they have played. And it's also important because when you go into these collaborations, you are able to leverage on the social capital of these other organizations you're partnering with. Let me tell you the truth. Adoption of healthcare technology has nothing to do with technology. It has everything to do with social capital. It has everything to do with the organization that has implemented something before and has shown true success. And you have a higher level of being adopted if you have partnered with an organization like that. And I'll give you an example. So I'll talk a bit about MyShaMed. So MyShaMed is a healthcare solutions company that is really focused on three things: technology. We're looking at health supporting providers and also partnerships. Technology, we digitize facilities, PPMVs and CPs, turn them from traditional pen and paper. And by doing so, we're able to know exactly what that facility is doing. We leverage on that what we call our reimbursement programs, where we try to change behavior in the adoption of the quality of healthcare service. And then from the initial two, we're able to get a lot of data that then allows us to inform policy and inform changes in the healthcare landscape. And we did some work in Nigeria, especially Lagos State, and found something that was very distinct. We found out that despite the data that was coming out of Lagos showing an increase in malaria prevalence due to microscopy testing, we did our own, sort of study and realized that malaria prevalence was not that bad in Lagos. And so what we did was, instead of going back to our donor to say, let us see how we can get more money to do this. And in fact, our donors were like, no, if it's not happening in Lagos, go somewhere else. We then created an arm where we sat down with the Lagos state government and developed a concept note. And that concept note was then leveraged on the impact funding, of which Lagos State had about $40 million to eradicate malaria. And we created a synergistic approach in doing so. It wasn't just about MyShaMed. That proposal had WHO involved, had NMEP involved, had PCN involved. It had Society for Family Health involved, and it had Lagos State government as an entity also involved, each performing a distinct role in that framework and in that collaboration towards a shared goal. And I would even tell you that even though we've submitted that proposal, we're going through a bidding process right now, Odere that is sitting beside me is not even aware of that proposal. But guess what? Their name is in that proposal because of a strategic partnership MyShaMed has with Odere. And we are going to be working with them, to deliver this once that program goes live. And so basically what I'm trying to say, and just to give you a hint about what that program does, the first thing is that it's going to do a comparative analysis study between RDTs and microscopy. This really has nothing to do with MyShaMed. And guess what? We're not the ones doing it. It's somebody else in that consortium. But when it comes to digitizing the facilities, putting it from pen to paper to electronic, that's where MyShamed comes in, right? And then it has linkage to health insurance to ensure sustainability. Somebody else takes up that. It has the accreditation of PPMVs. Somebody else takes on that. Yes. 1 month, I'll be done in 2 seconds. 2 seconds. So basically what I'm trying to say is that let us go together. There is more power, there is more impact, and there is more, things that we can engender by working together. Thank you.
Pardon me. It's very difficult moderating a panel with 6 speakers, with the time we have. So just to the last speaker, Abdul Hamid, you lead the technical backbone that drives eHealth Africa's work. Currently, we have over 30 active projects in over 24 countries across Africa. And these projects are all driven by technology that is developed in-house by your team that you lead. So my question is, how can digital health solutions be effectively adapted to align with Nigeria's local conditions? Speaking from your experience and drawing from your examples, particularly considering cultural nuances and infrastructure challenges.
Yeah, thank you very much. I think first of all, you have to go to the design phase. That's very key. You have to design with the context, local context in mind. And some of these factors will include limited infrastructure. Infrastructure is not the same everywhere. So when you're designing for Europe or US, it's different because they already have the infrastructure. The healthcare infrastructure is there. You can build and ride on top of that. So for us, when we're building, because all of these African countries you did talk about, most of them have limited healthcare infrastructure. So we have to factor that into the design of the programming or solution that we are doing. And there are ways you can do that. Number one will be offline capabilities. Now it's a no-brainer. I think 2013 or 14, when we did our first solution that had offline first capability, you had to do some workaround, do some tweaking. You have to scratch your head. But now it's even given in many platforms. Google Open Health Stack platform that we're using already comes with offline capability. So you don't even have to worry about that. Then coming to AI, you talk about light frameworks. There are AI light frameworks and models that you can use instead of using the heavier ones. I think we've played around with SqueezeNet, which comes in to my mind quickly. So what that does is it gives you the opportunity to deploy solutions in low resource environment successfully. And that can help you drive public health impact and scale as well. Then inclusivity, I think we've been talking about this also. You have to make sure while you are designing the digital solution, you include all factors, because sometimes you could design a solution inadvertently, you rule out certain gender. Maybe you might not be aware of that. Sometimes also you design a solution that did not take into cognizance the physically challenged, right? And now we even have the digitally challenged. So if a solution which will have been feasible for a very low mobile phone as the minimum entry for the resources, if you scale that and you now instead move to a higher mobile phone as the minimum requirement, you've just cut off a lot of people that will not be able to access that solution, right? So you've disenfranchised the digitally challenged, and you've strengthened, kind of increased the digital divide we're trying to bridge, right? So it's always good for you to take that into cognizance. Then you have, apart from inclusivity, you also have cultural sensitivity, right? There was a solution that was deployed way back in 2017. We were called in to assist because the same solution or platform was driving numbers in the southern part of the country, but it wasn't driving numbers in the northern part of the country. This is even within the same country, Nigeria, cultural peculiarities. And when we came in and we did our assessment, we found out that, oh, okay, there was just one simple problem. In the South, the women, the married women, they didn't necessarily require the consent of their husbands to enroll in the maternal program. But while in the North, it was critical to get the husband's approval before the women were able to enroll. We factored that, put that into the design of the software, and bingo, we started driving numbers astronomically in the North as well. So if you do not understand the cultural peculiarity, you won't be able to even understand that and even talk about putting it into the digital solution. So it's very, very critical. Then last one, maybe because of our time, user-friendly or user experience. Sometimes we take it for granted. If you're developing in a if you are deploying digital solution in a developed community, it's easy to know that you have access to the community. You can go there for capacity building. You have all of the infrastructure for that. But when you're talking about hard to reach areas, challenging remote areas that we find ourselves working in underserved area, rural areas, you have to make sure the user experience is good so that you don't have the luxury to continuously come back and train people. These people are not ready. They have other problems they are facing. So they don't give you that time for capacity building. So make sure you make the solution as easy to use as possible so that problems are not going to be encountered regularly, and you will not have need to come and train people over and over again. And another example I'll give to round up the contextualization, is when you don't understand the nuance of the environment. There was a program we designed one time. We thought we were solving a problem, but we ended up adding more issues because we didn't factor in certain cultural changes as well. But eventually, I think when we did our assessment, we were able to identify that. What am I referring to here? Make sure you go through the phases: co-creation, co-design, co-implementation, and even co-monitoring, so that you get all of the feedback at the end of the program and you feed it back into the design phase. And that's how we've been able to improve our supply chain management solution, which is called LOMIS. And that's why it's been in use in several states across the country now. Let me pause here because of time.
Thank you. Thank you, Abdulhamid. Thank you so much to all our speakers. To be honest, 50 minutes is not enough to have this conversation, but it is what it is. We have just a few minutes to round up this panel discussion. So I would turn the attention to the audience, and we would be able to take 2 questions. Yeah, oh, we already have 2 here. All right, let's see how many questions we can take, but maximum of 3 questions, please.
Okay, so my name is George. I'm from Nigeria, National Primary Healthcare. So my concern is about sustainability of some of these solutions, because I know that some of the partners that bring these solutions may not stay forever. They will one day go, or the program will one day wind up. So how are you planning to transfer that your knowledge so that it will continue maybe in the next 10, 20, 30, 40 years? That's my question, sustainability.
Thank you. So we will take all 3 questions at once, and then the panelists will answer them. Maybe we should take from another side of the room.
Okay. All right, sorry, my name is Nabil. I'm also from Nigeria. So just to add to what you said, we have been talking about AI, right? And we know Nigeria is diverse with local languages, social, economic, and different things. So how are you looking at sustainability, inclusivity, and infrastructure in AI? So we look at the local language, especially in Nigeria, our health workers, they are very diverse. So how are we looking at AI to adapt, health workers to adapt to their AI in local context? Thank you.
Hi, my name is Angela Muthoni from TICO. I think my question goes to the last speaker in terms of tech, coming from a tech background. You've mentioned that you're already working on over 30 projects. So how are you handling the scalability issues that come along with that? And I think also touch a bit on the kind of metrics that you use to measure the success of your tech. Yeah. Angela from TICO.
Thank you. Good day. My name is Dapo from Village Ridge. My question is to Olamide, and it's about AI and that boom in that sense. And we know that attention has moved in some sense from funders to funding AI tools and the likes. You had mentioned that AI is not, it means to the end. But in that ecosystem where there's a need for AI tools that in that sense are that hand, how do you balance getting along? I mean, you want to raise a business that gets grants, for example, but you know that the tool is not the end by means, but funders want the tool as the end. How do you manage that dynamics? Thank you.
Can I comment on the first question around sustainability? I think it's a philosophical issue. There's 2 philosophies. One says that the biggest impact of a healthcare tool saves your country government money. because it, for example, AI could help with human resource for health efficiencies. You need less health workers. So two things can happen. With the savings, a country government could contract a high quality provider to be sustainable. The other option is a country government builds a specialized team, has to manage that specialized resource internally, and has another complex department to oversee. So, and in that case, the provider has to transfer the skills and the country takes it over. But my argument would be, which is one we don't often hear or make, if we're saving money through these solutions in the AI and you're creating fiscal space, true sustainability is country governments using that fiscal space to fund quality AI and providers or digital tools.
Thank you, Dino. Abdulhamid, yours was the second question, but Dr. Lamdi, you want to go?
Yeah, I think mine is the third question, but I can go now. I think that's a super, super important question she asked about presence in 30 countries. How are you able to measure success and so on? So I think number one, I will still go back to the 3C, the co-design, co-implementation, and co-measurement. During the design phase or co-creation phase, you have to get out all of your KPIs, all of your indicators that you're going to track. I'll give you an example here. When we were working on the logistics management information system, one of the core critical indicators was stock out rate, because before we came in, vaccine stock out rate was at about 80–90% where we were working. And with our solution, because they lacked a platform for visibility into how the stock was even moving from one side to another. So what we're able to do with our solution, we were able to bring down the stock out rate from 90, in some cases to 1% or 2%. So that's a big scale and impact already, because for you to be able to bring out stock out rate from a rate of about 80–90 to about 1 or 2, 3%. So you have the indicator right from when you were designing the program. So that helps you to keep track of what your success is, what the issues are, and any issue you have, you take it back to the design phase as a feedback and use it to improve the next version of the digital solution. Then thirdly, or lastly, I should say, you need to have a regional design approach right from the onset. When you are designing, make sure, is this problem you are designing for, does it affect, is it an interconnected problem that cuts across the region? That's the only one way for you to quickly get into the other markets. I'll give you an example. Climate-induced disease outbreak. This is something that doesn't affect Nigeria alone. It affects other countries. So if you're able to develop a solution that helps address climate-induced disease outbreak, cholera and the rest, you are sure, it's a sure banker for you that you will get easy access to the other countries in Africa as well, because it's a common or shared or interconnected issue or problem that you are addressing. So that's also key. And it also helps you because during the design, since you are thinking regionally, you design something that is called, I think, replicability. You'll be able to replicate your solution from one community or one country to the other because you had that at the onset during the design phase, you had that in mind. So you've designed your platform to be able to operate that way. And lastly, also, you can take advantage of infrastructure that cut across countries. DHIS2 is one example, shared infrastructure. So if you build with that in mind, you'll be able to use right on this infrastructure that exists not only in your country, it's already in existence in other countries as well. I hope that addressed your question.
So I'll go after you because I have a feeling, yeah, please go.
Thank you very much. Thank you very much for that question. And I think the question on sustainability, I'll try to merge them into one. And to be honest, there's no real right answer for this in terms of what you need to do. You as an organization and as an innovator need to know what your priority is. Are you developing a solution for your donor or your funder? Or are you developing a solution for life, right? Or for it to be sustainable? And I think what you need to do is, depending on whichever is to tailor your application to that. So there's nothing wrong in tailoring an application to what a funder wants. And it's just for a short period of time, it does what it does and it closes. But if you're looking for long-term funding and sustainability, I think it's important to carry along the partner that can facilitate that for you, which essentially is government, right? And I think that a lot of times, even now with funders and with donors, the real question they ask you when you come with your innovation is there a sustainability angle to this? And how can you provide that, right? So I think that, sustainability just basically is dependent on who you're tailoring your solution to fit. And I'll give you an example. Nigeria has just Well, not just. In 2022, it passed the National Health Insurance Act, right? And it made the basic minimum package of healthcare services the model for delivering the health insurance scheme. I think as innovators, it's important for you to look in that basic minimum package of services, look at what those services are and see how your innovation tailors to that and how it can help in delivering that package. Because for the next few or couple of years, the most sustainable way that health will be financed in Nigeria would be through some form of health insurance or, so basically, I think that is my answer. Thank you.
Very quickly, if I may, I knew you'd highlight, things like national health insurance, government is key, mercy. Let's not sit in a vacuum in health or, AI and think, for example, AI is the panacea. If I have just $1 more a day, I will, as a mom, I will have better nutrition for my child. This has been proven. And so I think continuing to think about the economics of things, education, and everything else, all these health adjacent sectors that in the first place are responsible for some of these poor indicators is key. And let's never forget that.
Thank you so much. And with that, we have come to the end of the session. I do agree that we didn't have enough time to discuss, but I'm hoping that this conversation can be taken beyond this panel conversation. The panelists are still around, and I believe that there will be some discussions that will happen after now. So thank you so much to my panelists and to you, the audience. Okay.